Hello everyone, I'm Dr. Brendan Bradley. Today we're going to talk about iliotibial band syndrome, and we're going to talk about some effective ways on how to treat that. So first, let's define what the iliotibial band is. The iliotibial band is a really tight, fibrous connective tissue band that runs down the lateral side of your leg. The muscles that insert into that band are, one, the tensor fascia lata, which is a muscle that comes right off the front and ties in with that band, and then your gluteus maximus fibers actually tie in with that tibial band, that iliotibial band. And then the insertion points are down into the lateral aspect of your femur and tibia. Little bony prominences down there that they call tubercles. So this muscle is a muscle that commonly gets tight in runners or people who perform repetitive movement patterns and maybe aren't stretching as they should. A really effective way to stretch this band, I call it a band, it's a hybrid of a muscle and a band of connective tissue. So I might call it a band, I might call it a muscle. In either scenario, a really effective way to loosen that up is the use of a foam roller. So we're going to go over how to use a foam roller and how to loosen up this band and muscle with a foam roller. Before I show you how to use a foam roller to loosen up this muscle and this band of tissue, I want to just show you a picture of the anatomy. So this is a picture looking at your leg from the side view, and you can see here in the front aspect there's a muscle called a tensor fascia lata, and then in the back aspect or the posterior aspect you can see where the gluteus maximus comes around. Both those muscles tie in with the iliotibial band, and then you can see how it goes down the leg and attaches to the lateral side of the femur and the lateral side of the tibia. When this muscle is tight, a common complaint or symptom is lateral knee pain, and it's, as I said earlier, a very common complaint that runners often develop, or people who are doing any repetitive movement patterns with the hip and the leg and the knee. Okay, so now we're going to show you how to use a foam roller. So here I have two different foam rollers. Foam rollers come in different sizes and different densities. So the white one here is a 3-inch roller, and it's a pretty dense foam roller. And then the other one is a 6-inch foam roller. Also, this is a pretty dense one, so they're pretty firm. I'm going to illustrate this exercise with the larger one. I just find it easier. Having said that, the reasons for different sizes and different densities, however, is really dependent on maybe how tender and how tolerant you might be of using one of these. So if you find that you attempt this exercise and the foam roller you're using is a very dense one and it's intolerable, you might want to buy a less dense foam roller that's a little softer so you can tolerate it easier. Also, a smaller one is typically a little bit easier to start with than the larger one. So I'm going to show you how I do this and how I would suggest using it. You want to get a foam roller placed down on the ground. I'm using this mat here, and I'm going to put my body over sideways on this foam roller. Okay, now with the foot that is not being placed on the foam roller and with my hand, I can use my foot and my hand to kind of control how much weight I'm allowing my body to set onto this foam roller. So if you're tender, and believe me, if you have iliotibial band syndrome, you're going to be pretty sore through some of these areas. So you may need to kind of control your body weight and control how much weight you're placing on the mat, or the foam roller, sorry. Okay, so you want to start all the way down at the beginning or the insertion point, right at the lateral knee. And you can roll more towards the front or more towards the back, just depending on where you feel the tightness or the soreness. okay? So I feel a little more tightness and soreness as I roll more towards the front aspect of that band. And when you get there, then you just want to slowly start rolling back and forth. And if you take your time with this, you will begin to feel less pain as you do it. And that is the band starting to loosen up. You're starting to bring some blood flow into this area and break up some of these tight areas. And so just take your time and be patient. And like I said, if it's really sore, you can control how much pressure you're putting on by controlling your weight. As the pain starts to dissipate, then you just roll further up your leg, okay? And like I said earlier, you can control it. Wherever you feel the tightness and the pain and the tension, that's where you want to place your body by just changing the position. Either rolling more towards the back, more towards the front, or right in the middle, wherever you feel it. And then just slowly work your way up. When you get more towards the hip, as I said in the beginning, two muscles are tying into that. One of them is the tensor fasciae lata, and one of them is the gluteus maximus. And as you get higher up, now you're getting more into those muscle fibers, and you can release those muscles as you get higher up. So if I'm working towards the front as I am now, I'm getting into those tensor fasciae lata fibers, or I can roll back and get into my gluteal muscles. And you can feel when these muscles are tight, common symptom is going to be knee pain, but you can also get hip pain too. So once you get up to the hip, if you find some sore areas, just take your time and just roll back and forth and loosen this up. This will be very intense at first if you are symptomatic. So take your time with it. You can roll for as little as 5 minutes. You can roll up to 20 minutes. The longer you do it, the easier it gets. The first time you do this, you will probably be very sore the next day. So I might take 1 to 2 days off and kind of let things calm down, because you will create some localized inflammation at first. Once the soreness wears off, go back to it again. The more you do it, the easier it's going to get, the more flexible you will get, and the pain should start to dissipate. So I just want to share that real simple tip with you. If you do have a serious case of iliotibial band syndrome and these exercises alone are not relieving you of your symptoms, then you may need to seek the help of a professional who can address some of the imbalances that might be lending themselves to you developing this problem in the first place. So thanks for watching. And if you find this valuable, please leave some comments or some likes down below. We really appreciate it. And until next time, I'm Dr. Bradley with Bradley Chiropractic Nutrition Center. Thank you very much.